A new question for you. Oral contraceptives, need to complete the sentence. A. Inhibit ovulation. B. Alter the quality of cervical mucus to prevent or retard entry of sperms. C. Inhibit implantation. D. All of these. Well, among the birth control methods or the contraceptive methods which are used to delay a pregnancy or space a pregnancy or even avoid an unwanted pregnancy, oral contraceptive is one such method. It comes under the chemical methods. So we have the natural method, the barrier method of contraception, surgical methods of contraception. Now, these oral contraceptives are commonly called as birth control pills. Now, they have synthetic hormones. It can be progestogen, which is nothing but the synthetic progesterone, or a combination of both progestogen and estrogen. How do they function? They inhibit the development of the follicles. See, we know that when the follicles that are there in the ovary mature, that is when the Graafian follicle is mature, you're looking at the release of the secondary oocyte, which is nothing but ovulation. This development is inhibited by these hormones. So if there is no ovulation, obviously there is no fertilization, which means there is no implantation. So both ovulation and implantation get inhibited. Okay? And another thing that they do is that they change the environment of the cervical region. How do they do that? They make the mucus in the cervical region sticky and thick, okay, which in fact causes the sperm's motility to be reduced, or rather retards the sperm motility and prevents it from reaching the upper genital tract or the reproductive tract of the females. So now, if you look at this question, if you have to complete this statement, oral contraceptives, what are they? Is it only inhibit ovulation? Is it only alter the quality of the cervical mucus to prevent or retard entry of sperms? Or is it only inhibit implantation? We know that A, B, C are all correct. So we choose D, all of these as the right answer. We can eliminate A, B and C. D is the right answer. Now let's look at this question. Select the incorrect option. A. Non-medicated IUDs, that is the Lippes loop. B. Copper-releasing IUDs, that is copper 7. C. Hormone-releasing IUDs, that is multi-load 375. Or is it D. Nirod, which is a condom for males? Well, IUDs stands for intrauterine devices. Intra means inside, uterine referring to the uterus. Now, these are one of the most popular and effective contraceptives used by women in India to prevent pregnancy. Now, contraceptive methods or birth control methods are methods where a couple can use it to prevent a pregnancy or delay a pregnancy or plan a pregnancy, space out pregnancies. And IUDs are one of the most commonly used methods in India. Again, these are inserted into the uterus. It cannot be done by the woman herself. It has to be done under the guidance of a medical practitioner, such as a doctor or an expert nurse. Now, IUDs are categorized under three groups. We have the non-medicated IUDs. Lippes loop comes under them. Then we have the copper-releasing IUDs, such as the copper T, copper 7 and multi-load 375. And then we have the hormone-releasing IUDs, such as progesterone and LNG 20. So their action varies, their mode of action varies each one. So one is non-medicated, the other one is releasing copper ions, okay, and the other one releases hormones. So they act, on different, it could be to affect the motility of the sperms or to alter the environment of the uterus. So their method of working varies. Condoms is nothing but the barrier method of contraception, where there is a physical barrier present preventing the sperm from meeting the ovum. And one such condom is Nirod, a popular brand of condoms in India used by males. Now, condoms are present for males and females, but Nirod is one that is used by males. Okay? So now when you look at the question, select the incorrect option. Is it A, that is non-medicated IUDs is Lippy's loop is an example? That is correct. So we'll score that out. B, copper-releasing IUDs is copper 7. Yes, that is also correct. So we'll score it out because we need the incorrect option. C, hormone-releasing IUDs is multilode 375. No, this also is a copper-releasing IUD. So this is the incorrect option. That means this is our correct answer. And D also, it is correct because Nirod is a condom for males, but we score it out because that is not the correct option. For us, C is the incorrect option. So C is the answer. Okay, we eliminated A, B and D. C is the right answer. A new question for you. Which of the following is the least effective method of birth control? A, skin implants, B, periodic abstinence, C, pills, or D, IUDs? Well, birth control methods or the contraceptive methods are methods that are helpful in delaying a pregnancy or plan a pregnancy, space pregnancies, or even to avoid an unwanted pregnancy. Now, among the different methods that are there in birth control methods, we have the natural methods, we have the barrier methods, we have the surgical methods, the chemical methods, the implants, right? Now, in the natural methods, it works on the principle of preventing the ovum from meeting the sperm, or rather the sperm from meeting the ovum. But it does not use any external device or creams or any chemical. It depends on the natural cycles or the natural phenomena that happens in the body, right? Now, there are three different types under this. You have the periodic abstinence, also called as the rhythm method. Then we have coitus interruptus, also called as the withdrawal method. And then we have lactational amenorrhea, the absence of menstruation during the period of lactation after parturition. Okay, it lasts for about 6 months. Now, periodic abstinence is nothing but the couple abstain themselves from having unprotected sex during a certain specific period in the menstrual cycle. Now, assuming that the menstrual cycle is a 28-day cycle, the normal menstrual cycle, which is a 28-day cycle, day 10 to day 17 is considered, see the ones that are in green color. So, day 10 to day 17 are considered as the fertile period. Now, why is this so? That is because in a 28-day cycle, we can expect ovulation to take place on the 14th day or the 13th or the 15th day, which is why those boxes are dark green in color. Now, the ovum, right, the released secondary oocyte lasts for about 1 day. It's viable for about a day. Now, sperms, on the other hand, are viable for about 3 to 5 days. So, if there is coitus without any contraception during this period, chances of conception is very high and the woman can get or may get pregnant, right? Because fertilization can take place, which is why they say that this period, that is this time between the 10th and the 17th day, is the period that we call as the fertile period, and the couples abstain from coitus without any contraception, right? They abstain coitus without any contraception during this period. Now, pills, also called as contraceptive pills, and then implants. Now, all these are chemical methods of contraception. Now, skin implants, pills, and IUDs, that is intrauterine devices, they are efficient methods of contraception compared to the natural methods. See, in the natural method, chances of pregnancy are high. Chances of pregnancy are high. But when you're looking at these methods, that is, whether it is an implant or an injection or consuming the pill, here chances of getting pregnant is low. Okay? If you have to understand the comparison, you know, the efficiency of chemical contraceptives and periodic abstinence, which comes under the natural method, you can see the chemical contraceptives is way better, about 90 to 99% efficiency compared to periodic abstinence, which is about 80 to 87%. So, when you look at this question, which of the following is the least effective method of birth control? It is B. Periodic abstinence is the right answer. We eliminate A, C, and D. B is the right answer. Let's see this question. Which of the following is true about emergency contraception? A. Surgical procedure is involved. B. Levonorgestrel pills are used. C. Very effective when used within the first 72 hours of coitus. D. Both. B and C. Emergency contraception. Now, this is useful only to prevent unwanted pregnancies. Suppose a couple has sexual intercourse or coitus without any protection, without any contraception, and they suspect a pregnancy. Or in the case of sexual assault or rape, in such case, emergency contraception is used. These are pills. Now, these pills have to be taken within the first 72 hours of the coitus. It contains levonorgestrel. Now, what does it do? It prevents ovulation from taking place. It also causes the thickening of the mucus that is in the cervical area. This prevents the sperm from reaching the ovum. So the mucus becomes thick and sticky. What is not involved in emergency contraception are surgical procedures. There's no surgical procedures. It's a pill, like how you see here. The I pill is an emergency pill. Okay. So now when you look at the question, which of the following is true about emergency contraception? Is it A? No, we eliminate A. Is it B? Yes, B is correct. Levonorgestrel pills are used. This is correct. Very effective when used within 72 hours of coitus. Yes, that is also correct. So we have option D, which says both B and C. So D becomes the right answer. We eliminate B and C as well. D is the right answer. A fill in the blanks question for you. A national level approach to build up a reproductively healthy society was taken up in our country in dash. So which year? A, in the 1950s, B, 1970s, C, 1980s, or D, 1990s? Well, the national level approach towards building a reproductively healthy society. A reproductively healthy society is so essential to maintain and control the population growth, right? So this began with the family planning programs which were initiated and implemented in the year 1951. Now, there are several programs that were initiated. Now, all these come under one common banner called as the Reproductive and Child Healthcare Programs, the RCH programs. Very easy that question was. So the right answer to this question, a national level approach to build up a reproductively healthy society was taken up in our country in the 1950s because it's 1951. So A is the right answer. We eliminate B, C, and D. A is the right answer.